Good morning, everyone, and welcome to the workshop on opportunities and challenges for using digital health applications in oncology. This workshop is co-sponsored by the National Cancer Policy Forum and the Forum on Cyber Resilience. My name is Larry Shulman. I'm a medical oncologist, and I'm Deputy Director for Clinical Services of the Abramson Cancer Center at the University of Pennsylvania. Next slide, please. As many of you know, the National Cancer Policy Forum provides a continual focus within the National Academies on cancer, addressing issues of science, clinical medicine, public health, and public policy that are relevant to the goal of reducing the cancer burden. And on this slide, you see a number of the workshop briefings that we've prepared over the years, and they're available online. Next slide, please. The National Cancer Policy Forum could not do its work without the support of many institutions, societies, pharma, and other organizations. We're very grateful to all of them. This is a list of the ones that have been supportive to us. And again, none of what we do could be possible without them. I'd now like to introduce Dr. Fred Schneider, who is chair of the Forum on Cyber Resilience. Fred is the Samuel B. Eckert Professor of Computer Science at Cornell University, joined the Cornell faculty in 1978, and his research has always concerned various aspects of trustworthy systems, systems that will perform as expected despite failures and attacks. Most recently, his interests have focused on system security. Fred, thank you very much for co-hosting this workshop. I'll turn it over to you.
Thanks, Larry, and let me add my welcome to everybody who is participating. The Forum on Cyber Resilience looks to be a locus of expertise within the academies and the nation. It's a group of about 24 people. Their interests span technology to policy, so we've got engineers and lawyers, and these folks have a natural affinity to talking about issues that span a broad spectrum of topics. We strive to identify and articulate problems before they're known about in Washington or on the nation's radar, but we're also happy to provide consulting expertise to various bodies who have a good cause. And of course, we're a resource for the National Academies, where increasingly activities seem to have a projection onto what in Washington is known as cyber. Next slide, please. If you're a student of Watergate, then you know the way to think about things is to follow the money. Our funding comes from NSF, which is the largest funder of academic research in cybersecurity, NIST, which is the government organization that's concerned with civilian cybersecurity, and NSA and SCORE, which represent the intelligence community. So we've got sponsors who are interested in technology, in national security, and in international issues. We're also a close sibling and share staff with the Computer Science Telecommunications Board of the National Academies, which puts us very close to all of those issues. Next slide. We have impact in various ways. It's not unusual for the executive branch initiatives to come and chat with us while things are in progress. And like any other forum, we have the National Academies' moral authority and cred to convene groups of people who wouldn't normally talk to each other. As a recent example, we brought together some folks from the private sector who run large software organizations and the intelligence community and asked each how they handle the notion of insider threat. That's when somebody who works for you is attacking you. And everybody was surprised to discover that despite their differences, the intelligence community requires you to have security clearances. Commercial sector doesn't do anything like that. So despite these different climates, they tended to use the same methods and made the same kinds of trade-offs. So that's a marriage that would have never happened, and this sharing of ideas advances the case. We also, of course, propose and staff spin-off National Academies consensus studies, and we help out with activities like today's workshop. Next slide, please. Our sweet spot seems to be problems that span both tech and policy. This slide lists some of our recent activities. I'm not going to have time to talk about many, but let me mention one to give you a sense of how this works. Most of you are familiar, only from reading the newspaper, with data breach and divulgence of personally identifiable information and privacy. And there are various laws that are supposed to disincentivize this. Almost all of them are concerned with your financial status and recovering from credit card loss. If you look, however, at what happens, that's only a small piece of the picture. For example, there were a number of people whose identities were divulged a couple of years ago when the Ashley Madison dating site, this is a dating site for marrieds seeking marrieds, were divulged. And for these folks, having their credit card known was the least of their problems when their identities got known. Yet, nobody's thinking about what kinds of laws might disincentivize that. This is the kind of problem we seek to discover and articulate to raise a sensitivity. Next slide. Like this forum, we convene workshops. We tend to have 1 or 2 a year, and we publish volumes. They're available on the web for you. They summarize what's been discussed and try to get issues on people's radar. Next slide, please. And that brings us to this workshop and our involvement. We're hoping to learn about cyber challenges that oncology faces that merit further study. And we're especially eager to learn places where technology and non-technology intersect. It's a moving target. 6 months ago, if you were worried about privacy in medicine, you were probably worried about EHR. Today, you may well be worried about contact tracing, which wasn't on anybody's radar. And finally, I'm hoping, and my charge to the workshop, is to try to identify cyber issues that are unique to oncology and not just related to medical issues. And that's the kind of thing, once it's identified, often leads to interesting issues. So let me hand things back over to Larry, and I wish you all a very productive workshop.
Thank you so much, Fred, for your insight and for your support. Next slide, please. So our workshop goals are listed here to provide an overview of digital health in oncology. And as Fred said, we're focused specifically on cancer medicine for this workshop, though obviously there's a lot of overlap with general medical issues. We want to highlight some of the exciting work that's going on nationally in digital health applications to let us know where the field currently is going. We need to discuss regulatory, ethical, security, governance, and payment considerations. They're all influencing how we move forward, and I think really need to be reconsidered about how we approach many of them. We want to identify opportunities to improve data availability and use in EHRs and large databases. This has become even more acute in the pandemic, when we're desperately trying to get information about how health in the US is going and how we're managing our patients with and without COVID. And finally, we want participant reactions and recommendations for our path forward. And we end a lot of our workshops with a panel, as we will this workshop, asking key stakeholders to tell us how they think we should move forward from this point on. Next slide, please. So we have a day and a half workshop. This is the agenda for today. There will be 4 sessions if you're a lumper and 5 if you're a splitter. The first session is an overview in digital health applications, which we'll get into in just a moment. The second session will be lightning presentations on a number of examples of what we think are innovation uses for digital technology in oncology. We will then transition into the FDA vision and priorities for regulation of digital health applications, and a lot that they're involved in, and we'll have a Q&A with Amy Abernethy from the FDA, with me. Then we'll deal more in detail with ethical, security, governance, and payment considerations. And finally, session 4 will have patient-facing digital technologies as its topic. Next slide, please. Tomorrow, we will have a half day, and the 5th session will be opportunities to improve data availability and usage in EHRs and large databases. And then, as I mentioned, finally, our last session will be a panel discussion with participant reactions and recommendations for the path forward. We encourage all of you to ask questions of the speakers via the chat box below the webcast. Please include your name and your affiliation with your questions. That's very, very helpful to us. And we will share your questions with the moderators and the panelists as time allows, though we're likely not to be able to get to all of them. And if you're a tweeter, we encourage you to tweet using the hashtag listed below. Next slide, please. I wanted to acknowledge our planning committee, and the names are listed here. You're going to hear from all these people during the next day and a half, so you'll get to hear their bios and learn a little bit about them. When we started planning this workshop, none of us knew what COVID-19 was. And as Fred alluded to, we were worried about somewhat different issues, and now there are new issues to worry about. We met a countless number of times over the last year and a half, and it's really their work that has pulled together the workshop. I also wanted to acknowledge the National Academy staff who was listed here, all of whom played a huge role in bringing this workshop together. Without these people, this would never have happened. So thank you all very much. Aaron, Lori, Kate, Annalie, Emily, Lynette, and Cheryl. They did just yeoman's work in preparing for this workshop. Next slide, please. We just wanted to put in one short advertisement and plug here. The NCI has put out a request for information, an RFI, with a relatively short timeline with responses due on July 30th, which is, I think, only about 2 weeks or a little bit more away. And they're looking for stakeholder input on scientific gaps and research needs related to the delivery of cancer-related care via telehealth. All of us who are in the position of providing care have gotten to know telehealth more than we ever imagined. That includes me and many who will be on the panels in the next day and a half. And so the links are shown here, but we need everybody's input really to move this forward. So on that note, I'm going to transition to introducing session 1. And session 1 is an overview of digital health applications in oncology, and we have 2 speakers for session 1. The first speaker will be speaking about digital health and cancer, and that's Mia Levy. Mia is the Sheba Foundation Director of the Cancer Center at Rush University Medical Center and the System Vice President for Cancer Services at Rush System for Health. She's Associate Professor of Medicine in the Division of Hematology Oncology, a practicing medical oncologist specializing in the treatment of breast cancer and precision oncology. Her research mission is to develop and disseminate learning cancer systems that deliver data and knowledge-driven clinical decision support across the continuum of cancer care and research. All of us who have been in this field know Mia well. Her contributions previously at Vanderbilt and now at Rush have been incredible. Our second speaker for session one is Anand Shah. Anand is the Deputy Commissioner for Medical and Scientific Affairs of the Food and Drug Administration. He leads the agency's operations as it relates to medical and scientific affairs. He's responsible for developing and leading high-priority FDA policy initiatives and oversees cross-agency teams in support of FDA's public health mission. He recently served in 2 senior leadership roles at CMS. He was a senior medical advisor for innovation, where he was the primary counselor to the administrator for agency-wide policy related to medical and scientific innovation. And previously, he was the chief medical officer at CMMI. His talk is the keynote presentation entitled COVID-19 and Oncology Digital Health, the FDA Perspective. So I think with that, if we can move to Mia's talk, I do want to make one last comment just for those of you who are listening. Our talks have all been pre-recorded. We did that for a variety of reasons, and we hope that that will help to make the whole workshop go smoothly, but the discussion periods are live. So as I mentioned previously, please submit your questions to us, and we will have what I'm sure is a lively live discussion period after the formal presentations in each one of the sessions. So with that, if we could put up Mia's presentation, that would be terrific. Thank you.